that is Sustainable Development Goals. Sustainable Development Goals, we have SDG 3.1 to 3.9 followed by SDG 3.A to 3.D. Okay. 3.A to 3.D. Now, when you're writing any answer for maternal health related questions, focus on SDG 3.1. So global target is to reduce MMR less than 70. Now we currently have 102 as per 2020 report. The goal is to reduce global MMR less than 70. This is SDG 3.1. SDG 3.1. 3.2, after mother, next comes is child health. By 2030, the goal is to end preventable deaths of neonates, infants and children and under 5 children. The target is neonatal mortality rate less than 12, under 5 mortality rate less than 25. Okay, NMR less than 12 target and under 5 mortality rate is less than 25. And this is SDG 3.2. SDG 3.3 is to end epidemics of. If you are writing answer for AIDS, you can take SDG 3.3 because end epidemic of AIDS by 2030. End epidemic of TB by 2030. That is again SDG 3.3. Malaria is also SDG 3.3. And also neglected tropical diseases. We have a separate focus now. The whole world is focusing on NTDs because with very good initiatives and national health programs, we were able to control these major diseases. But almost 1 billion people over the world are now suffering with neglected tropical diseases. There are around 20. Among them in India, these are the ones which are commonly seen. That is dengue, filaria, snake bite, scabies, yaws, trachoma, leishmaniasis, Chagas disease, and guinea worm. But guinea worm is eradicated in India. So these are the things which we usually see. Among them, dengue, filariasis, leishmaniasis are there in the syllabus. Even snake bite is there as a part of management. Even scabies is there as a part of management. They're all neglected tropical diseases. To end epidemic of NTD is SDG 3.3. You can just either add it as an introduction or a conclusion. Yeah, yaws also eradicated. Yes. Done. So these are the NTDs which we see. The SDG 3.3. Along with SDG 3.3, there is one more heading in it. We are not trying to end epidemics, but definitely it is important to combat waterborne diseases, hepatitis, and other communicable diseases in the community. Okay, there is a global initiative to end neglected tropical diseases. This NTDs is a good social issue, and I think in regular general studies also they ask questions on this. There is a WHO new roadmap for 2021 and 2030, which calls for 3 strategic shifts to end NTD. Okay. First strategic shift is, instead of measuring the process, we have to measure the impact of the program. Instead of just disease specific planning and programming, we have to work in a collaborative way across all sectors that gives you an impetus to the program. Instead of an externally driven agenda, okay, WHO or world should not push India to do something. It should be internal. That is, it should be a country owned and a country financed program. So this global initiative to shift gears into the 3 different strategies. Okay, that is a global initiative to end NTDs. Now we're done with 3. 3.1 is maternal health, 3.2 is child health, and 3.3 is to end epidemics of AIDS, TB, malaria, and to combat waterborne hepatitis and other communicable diseases. SDG 3.4 is focusing on non-communicable diseases. Mainly, we have diabetes mellitus, ischemic heart disease, hypertension, metabolic syndrome, and all. So when you're writing answers for that, you can quote SDG 3.4. Okay. So the goal is to reduce premature mortality by these non-communicable diseases at least 1/3. Okay. We know the widowmaker, right? The coronary artery disease, and how the leading cause of CKD is diabetic mellitus. Hypertension is also increasing. So to control all these things and to reduce premature mortality by 1/3 is the goal of SDG 3.4. SDG 3.5 is associated with drug abuse and alcohol abuse. SDG 3.6 is road traffic accidents. SDG 3.7 is reproductive health. So when you're writing answers for contraceptives and all, India is working towards ensuring universal access to all the reproductive healthcare services and family planning services via SDG 3.7. SDG 3.5, yes, it is organizational, that the quality health services should be provided and medicines and vaccines should be provided in an affordable way to the population. So in that way, we have 2 programs. One, quality healthcare services, as I said, Pradhana Mantri Swasth Suraksha Yojana, where we are setting up new tertiary aims, and also we are strengthening the infrastructure of the medical colleges and district hospitals so that quality healthcare is provided. In the similar way, we have modified them into health and wellness centers through Ayushman Bharat. So this is how you have to link your answers to the what is India doing via national health programs. Affordable medicines, we have this PM Modi set up uh, medicine shops, which are generic medicines. So this program is PM Bhartiya Jan Aushadhi Pariyojana. Okay, I was able to spell it correct. Bhartiya Jan Aushadhi Pariyojana, which is generic medicine program, right? Done. SDG 3.8. 3.9 is all about pollution, which were least concerned now. Okay, for this exam, because pollution or pollution related PSM aspects are not there in the syllabus, maybe in for general issues you can integrate it from GS point of view. The organizational are not that important. Organizational says country should have tobacco control measures, country should invest in research development of vaccines and medicines, country should invest health finance and HR management part, and also global and national health risk preparedness should be there, so that if new epidemic like COVID or something else comes, as a country and as a globe, as a world, we should be well prepared to tackle that. So these are organizational SDGs, not that important, but public level SDGs are this, where the public is actually getting impacted through the SDGs, right? So